The efficacy of COVID-19 vaccines has been brought into question again as a new study has found them to protect the clinically vulnerable less than healthy recipients. Those with conditions such as blood cancer, liver disease and inflammatory arthritis are less likely to be protected against vaccines. The OCTAVE study, a multi-centre UK-wide trial led by the University of Glasgow and coordinated by the University of Birmingham's Cancer Research UK Clinical Trials Unit, is evaluating the immune responses to COVID-19 vaccination in patients with immune-mediated inflammatory diseases. The trial is one of the largest studies in the world so far into post-SARS-CoV-2 vaccination in immunocompromised patients. OCTAVE also used a variety of state-of-the-art immune tests performed on blood samples taken before and or after COVID-19 vaccination in around 600 people recruited across the UK. Early data show that 40% of people in the patient groups studied mounted a low serological immune response after 2 SARS-CoV-2 vaccines. The initial data shows that approximately 11% of immunocompromised patients failed to generate any antibodies 4 weeks after 2 vaccines. Failure to generate antibodies is found at higher proportion in some specific patient subgroups, in particular, in patients with ANCA-associated vasculitis who have received rituximab treatment. 1 in 10 people with weakened immune systems did not generate any antibodies at all, while 40% were found to have fewer than people with no underlying health conditions. OCTAVE found that the amount of patients with lower levels of antibodies as per disease cohort compared to the baseline for healthy recipients were those with antineutrophil cytoplasmic antibody, ANCA-associated vasculitis, AAV, a group of diseases characterized by destruction and inflammation of small vessels, who are being treated with rituximab, 90% those with inflammatory arthritis, 54% those undergoing hemodialysis, the most common kind of dialysis, a procedure to remove waste products and excess fluid from the blood when kidneys stop working properly, 21% those on hemodialysis receiving immunosuppressive therapy, 42% those with hepatic, liver, disease, 51% those with solid cancer, 17% those with hematological malignancies, blood cancers, 39% those who have undergone hematopoietic stem cell transplant, bone marrow transplant, 33% how much sleep should you be getting? 8 tips for the best night's sleep, insight stroke, the lifestyle habit increasing your risk of the life-threatening condition, study can stress cause our hair to go grey prematurely? Expert explains the science of graying? Expert advice, Director of the University of Birmingham's Cancer Research UK Clinical Trials Unit, Professor Pam Kearns said of the trial, a significant number of people in the UK were advised to shield because they have conditions or long-term illnesses which place them at greater risk of severe illness and death from COVID-19. The rapid development of vaccines for COVID-19 has been a major step forward in the battle against this global pandemic, and the most clinically at-risk people were among the first in the UK to be offered one. Professor Kearns went on to conclude that, while we know COVID-19 vaccines are highly effective in healthy individuals, questions have remained as to how effective they are in protecting the chronically ill. She also explained that these preliminary results would aid authorities' decision-making on how to further vaccinate the clinically vulnerable. 39% of blood cancer patients were seen to have lower levels of antibody recovery in the trial. Caroline Donahue, Senior Scientific Knowledge and Communications Officer at Blood Cancer Research Organisation, Myeloma UK, told the Daily Express, data has consistently shown that some myeloma patients, especially those on treatment, do not respond as well to COVID-19 vaccines, with some patients producing markedly lower levels of antibodies or even no antibodies in response to the vaccines. Many myeloma patients are still living in limbo as a result, not knowing whether the vaccines are helping to protect them against COVID-19. To have this data on the immune response to the first and second dose of the vaccine in immunocompromised is fantastic. It clearly shows there is an increase in immune response from first dose to second dose in immunocompromised patients. This suggests that patients could benefit from a third dose and booster, and why the data played a big role in the JCVI's decision to recommend a third primary dose of the vaccine for this group. A new study, named OctavDuo, has been launched to find if a third booster jab makes a difference for those who vaccines are less effective for. Health Secretary Sajid Javid said that a booster program would play an important role in protecting those most at risk. He said, "Vaccines have built a strong wall of defense in the UK, and this is allowing most of us to learn to live safely with COVID-19. We know some people may get less protection from the vaccine than others, so we are planning for a booster program in the autumn, prioritizing those most at risk." This new study will play an important role in helping to shape the deployment of future vaccines doses for these specific at-risk groups.